Culturally and practically, the working relationship between Scotland and Malawi has never been more essential.
The Scotland-Malawi Partnership, the SMP, is the National Civic Society Network, coordinating, supporting and representing the many people-to-people links between our two nations. Over 100,000 people, in fact, are involved in Scotland, from schools, universities, colleges, churches, secular groups throughout Scotland, from the borders to the Northern Isles. And the Scotland-Malawi relationship is not about one-way charity. It's about dignified partnership, joint working, friendship and mutual benefit.
More specifically, the effects of the pandemic are beginning to show in Malawi for the first time.
Malawi's President Peter Mutharika announced the first 3 confirmed cases in Malawi on April the 2nd, the first in the nation's capital, Lilongwe. Prior to that, important steps have been taken to prepare Malawi for COVID-19. These, as we see it, included early action from government, closing schools and universities and banning large gatherings of over 100 people. Clear advice through mass media on hand washing, social distancing, significantly increasing hand washing facilities, for example, on gates to markets. 3 testing centres have been established and are operational, but actually working on quite low numbers. There's been a donation of 20,000 rapid diagnostic kits for testing, and the Scottish Government's provided further support as part of its long-standing links with the College of Medicine in Malawi. £1.8 million of supports come from the British Government's Department for International Development, DFID Malawi. That's come through UNICEF Malawi, and there's been a strong coordination and clear planning from the Ministry of Health and College of Medicine. Tragically, a first death from COVID-19 was reported on the 7th of April. There's highly skilled scientists, medics and policymakers in Malawi, but budgets are small. There's a significant challenge for Malawi around resources needed to respond to a major pandemic like this. Experts from Malawi and Scotland have told us that there's a need to significantly increase the capacity of testing centres, that there is a lack of chemicals for testing. There are practical challenges around ensuring social distancing in areas, especially of dense population. And to put it in context, there's fewer than 20 ventilators in the whole nation for a population of around 19 million as things stand.
It is the needs of both sides that underline the importance of shared communication.
In the same way that people in Scotland are now perhaps having even more phone calls and computer contact with family and friends than before, so too are they pulling together with their friends in Malawi. Scientists and healthcare professionals here in Scotland are collaborating in partnership with their counterparts in Malawi. Responding specifically to the need for resources, our members are organising appeal funds. Malawians living in Scotland, the Malawian diaspora, have already launched an appeal to raise funds for face masks for frontline healthcare workers. We would expect more appeals to follow, including from national and international aid agencies for that much needed support.
The Scotland-Malawi Partnership is keen to emphasise that this is a mutually beneficial relationship, not one of one-way charity. The unifying sentiment is that tackling a global pandemic requires global collaboration. Ian McNally, That's TV.